Cool.
Hi guys, I'm Bella with Arc El Paso, and I'm here with Todd. He is a pediatric dentist over at Texas Tech Health Sciences Center, and he is going to tell us a little bit about oil pulling. I've seen it as a trend on social media, and I'm not really sure how much it works. Can you tell us if it is something that you should be doing for your dental health?
Okay, well, let's start with that. It's not the magical panacea some may want you to believe it is, but it's really not total nonsense either.
Not a cure-all, but it definitely works somewhat. What does it do for your teeth?
Well, let's take a step back. So let's be honest. Anytime something ancient gets rediscovered on social media, it's either called a miracle or a myth. So oil pulling falls somewhere in between. And I'm not here to call it witchcraft, but I'm not gonna hand out my toothbrush either. So what it is, the basic process of oil pulling is where you take in a tablespoon of some form of an oil. It can be coconut oil, palm oil, sunflower oil, sesame oil, and you rinse for 15 or 20 minutes. And the belief that you read on social media or you hear about commonly is that it'll freshen breath, whiten teeth, reduce plaque and gingivitis, and it can support your overall health by supposedly pulling out toxins.
Okay, and what does it really do, and what does it lack when it comes to teeth care?
Well, what it lacks more than anything is the science, peer-reviewed science. And as a board-certified pediatric dentist, we want to do things that we can replicate in everybody's home. So if we say that it's going to occur, that it will. And the science really doesn't support it. But the reason why it maybe worked in years past is because it was only until the 50s or 60s of maybe the last century that we actually started placing fluoride in toothpaste and had people brush their teeth on a regular basis. Now, if you did nothing else except rinse with some form of an oil, and the oil has fatty acids in it, and when you mix that with the bicarbonate in the saliva, it actually can make like a little sudsing action and clean the teeth ever so slightly. So again, if without a toothbrush, without fluoridated toothpaste, maybe it's a good idea going back hundreds of years ago. But today, we don't have any factual basis that oil pulling works.
All right, and so what should people be doing to take care of their teeth on a day-to-day basis?
Well, you could still oil pull if you want. Take your tablespoon. It's not going to hurt anything. Might clog your pipes or such at the house, but what you should do is you should brush and floss. That's the same thing that your local dentist will tell you. Floss every day, use a fluoridated toothpaste, brush for a couple minutes, get that plaque off, get that biofilm, that stickiness that you feel on your teeth. That's what causes cavities. That's what causes gum disease. So if you want to start with the little oil pulling, excellent. But let's don't have it replace brushing your teeth and flossing on a regular basis.
Alrighty, well, thank you so much for enlightening us on that. And you heard it right here. Brush, floss, and use fluoride toothpaste. Arc El Paso will be right back after this break.